just wanted to update folks on trends east of us in the US, where we can expect they are giving us a preview of what's coming here, and then maybe some slightly updated projections on peaks based on what we're seeing in those trends. So this is a good compendium from the New York Times of the states that are at highest levels now. Sorry, I need to put it on screen share. There we go. So you can see the US is still climbing as a country at over 300% of previous peak of cases, and now have surpassed 100% of previous COVID hospitalizations. I think the thing to take out of this that we've spoken about before, I think, is if you look at the slope of the growth for the US curve, you'll notice that the slope is quite a bit less than it is for individual states. And this is that phenomenon of averaging out multiple epidemics that are asynchronous in various places. So if you look at the states, you'll see that the slopes are much more steep. They shoot up quicker, but they occur at slightly different times. So when you put all of those together, you get a curve where it's drawn out and extended. And so I think sometimes people perhaps misinterpret some of those things and infer that because in certain places like New York City or New York State, you get this very rapid increase, and then often in some places now, it looks as if there may be a rapid decrease. When you average that out over a larger geographic area, like an entire state or an entire country, that draws out the timeline quite a bit. But I think if you look at the states that have been the leading edge on the East Coast, you see that a number of them now seem to have rounded a corner and are seeing their case counts drop. Obviously, the slope of that and the timing of that is yet to be seen. I'm not sure it's going to be quite as precipitous as some people are projecting, but let's hope it will be. I think the other thing to point out is where these states have peaked in their cases, they have not yet peaked in their hospitalizations, and that is consistent with the trends that we've seen previously, that hospitalizations lag by at least 5 days, more commonly 7 to 10 days. And so it will be another week or so before many of these see their hospitalizations peak and round the corner. You'll notice that Rhode Island and New York have peaked at over 400 to 500% of their previous peak, over 500%. And their hospitalizations have peaked at well over 100%. You can see New York is close to 175% of their previous peak. So we are seeing huge numbers, despite projections of the mildness of Omicron. So that's kind of the time course that we can potentially project. If you look at those, and we'll go back here, the period of explosive growth for most of these places is really only in the range of 2 to 4 weeks. Some of these states are going to be difficult to deconvolute the growth of Delta, which occurred early in December in many of them, with the growth of Omicron, which was kind of coming up at that same time. And so, that Delta wave from November, December slurring into the Omicron wave makes it a little more difficult to kind of tease out the timing of Omicron growth. But I think it's safe to say that, 2 to 3 weeks or 2 to 4 weeks of explosive growth from Omicron is not an unreasonable projection based on what we've seen in these other states. If you look at a couple of additional states, I've continued the trend of calculating that decoupling factor, looking at the difference between cases and hospitalizations. in this wave compared to previous waves. And as we've seen, when you get outside of the East Coast, where, and the Northeast in particular, where vaccination and boosting rates are higher than national average in general, you start to see decoupling factors go down even more. And so where most of those states on the East Coast, the average was certainly above 2, you're now seeing states in the upper Midwest and Midwest with much lower decoupling factors. So you can see here, Wisconsin so far for this wave looks like they have decoupling only of 1.3, and Wisconsin has, now matched their previous high in hospitalizations. They have not yet peaked in their cases, so you can estimate they have at least another week of growth of hospitalizations, and from that slope you can see they will far exceed their previous high. Indiana in the same boat, their decoupling factor 1.6, so again well below 2, and they also have not yet peaked in their cases, and so again have at least another week of growth in hospitalizations. For Nebraska and Douglas County, you can see here we started that kind of exponential growth phase for Omicron right after Christmas. Right now, based on our current numbers, we hit about 225 cases per 100,000 per day yesterday, and that gives us a doubling time of about 11 days. We're at a test positivity rate of around 38%, depending on how you count. That is close to the peaks that many other states and regions, counties east of us achieved. But again, we tend to test at a slightly lower rate than some of those areas in the East Coast. So I expect we still have a little ways to go up for positivity rate, although I think we are approaching our peak. The rest of the state looks like it's a week or so behind us. Sorry, I thought I actually threw that additional entire state graph up there, but nevertheless, this is our positivity rate, and you can see we're still climbing at a pretty steep slope, and so expect that positivity rate will go up even more. But based on all of those things, if I had to take a guess, and remember these are indeed guesses, I would say that we have still probably another week to 2 weeks of growth in Douglas County. I'm thinking more along the lines of a week than 2, but remains to be seen. I think we'll probably in that week, get another 50 to 75% growth in cases. So we'll probably peak in Douglas County around 325 per 100,000. If that timeline is correct, and that means our hospitalizations will probably peak around 5 days to 7 days after that case peak. So for hospitalizations, that means we still probably have another 2 weeks of growth, unfortunately. I think our decoupling factor in Douglas County will be better than many other places in the Midwest, but I've adjusted down a little bit from what I had predicted last week, just because most states outside the East Coast appear to have a much lower decoupling factor, which means more hospitalizations for a given caseload. For the state entirely, I think the state will probably, much of the state, especially in the middle and in the Panhandle region, are probably a good week or 2 behind the East. I think the state on average will probably peak about a week after the East does, maybe 5 days. So we'll see that peak occur somewhere between the 25th of January and the 4th of February, I think. I actually think our statewide case count at our peak will be lower, but that's really related to under ascertainment rather than a lower per capita caseload. I think many counties in the middle and west of the state will actually have higher true case numbers. I think our decoupling factor will be lower because of the lower vaccination and boosting rates across much of those states. So I think our hospitalized patient burden related to our case count will be even higher. So that's kind of where I see things going right now. And we'll be interested to see if we have any of Matt Donohue's data today in terms of state trends to correlate this with, but those are current best guesses. Thanks.
Thanks, Dr. Lawler. All right.